The telegraph wires are dead. The government won't admit exists. One small-town editor picks up his pen anyway and changes everything. Stick around, hit subscribe. You'll want to see this. September 1918. Kansas dust hangs in the air outside a one-room print shop, and inside, a man named Walter Greene is setting type by lamplight, ink staining his fingers black. You can smell it. Hot metal, kerosene, the sour tang of a press that's older than the town itself. Outside, soldiers are shipping out from nearby Camp Funston. Inside, Greene is staring at a letter from a doctor friend. Boys are collapsing in formation, lungs filling with fluid, skin turning blue. The federal government calls it morale-damaging talk. Under wartime censorship laws, newspapers that print alarming health news can be shut down, their editors jailed. Wilson's administration wants America focused on one enemy, Germany, not an invisible one crawling through army barracks. Greene knows the law, he knows the risk. He sets the headline anyway. What he doesn't know yet is that his tiny 4-page weekly, read by maybe 2,000 farmers and shopkeepers, is about to become the first crack in a wall of silence stretching across an entire nation. And that crack is going to save lives nobody in Washington is even counting yet. The next morning, the paper hits doorsteps smelling of fresh ink and trouble. Greene didn't write a panic piece. He wrote numbers, real ones pulled from his doctor friend's logbook, case counts, death counts, which symptoms came first, how fast it moved through a barracks of 40 men. He printed something nobody else dared to, a simple list: wash your hands, avoid crowded halls, close the windows at night, not during the day, boil the bedding. It reads almost embarrassingly plain by today's standards. In 1918, it's radical, because the only health information most Americans are getting is government reassurance that everything's under control. It isn't. Word spreads faster than the press can run. Farmers ride into town just to read the bulletin board where Greene pins each new issue. A grocer down the street starts handing out cloth for masks. The schoolteacher closes her classroom 3 days before the county health office even discusses it. Then the letter arrives. Stamped, official, threatening. A federal censor in the regional postal office has flagged Greene's paper for spreading defeatist material harmful to the war effort. One more issue like this, the letter warns, and his press will be seized. Greene reads it twice at his kitchen table that night, his wife watching him from across the room, the lamp flickering between them. He could fold. Most editors did. Instead, he picks up his pen and starts writing the next issue, and this time he names names. Which officials knew? Which officers ordered sick boys onto transport trains anyway? He has no idea that 3 counties over, another editor is about to read his paper and do the exact same thing. By October, something strange is happening across the rural Midwest, something no one in Washington planned and no one can explain at first. Towns that get Greene's paper, or papers that copied his format, are showing different numbers. Not 0 deaths, nothing stopped this virus completely, but slower spread. Fewer infections per household. Hospitals that aren't overflowing the way they are 40 miles away in towns still trusting official silence. You can picture it. 2 same size, same season, same flew loose in the air. In one, families are sealing their windows shut on bad advice, still shaking hands at church, still packing into the Saturday dance hall. In the other, doors are propped open for fresh air, gatherings are cancelled. Sick neighbours are quarantined in spare rooms with bowls of broth left outside the door instead of warm company inside. The difference isn't medicine. There is no vaccine, no real treatment in 1918. The difference is information. Plain, blunt, local information moving faster than fear. Greene's paper gets reprinted, copied by hand in some cases, passed between towns like contraband. A teacher in the next county transcribes his hand-washing list onto her chalkboard. A minister reads sections aloud from the pulpit, calling it common sense dressed as defiance. The federal censor's office isn't laughing anymore. By November, Greene receives a second letter, this one threatening arrest, not just seizure. He's summoned to explain himself before a wartime council 2 counties away, the kind of hearing that's ended careers, presses, and occasionally freedom for less. He goes. He brings the doctor's logbook with him, the same one that started everything back in September. And what happens in that room is something no government official expected to hear from a small-town printer with ink permanently ground into his knuckles. The hearing room is small, wood-panelled, smelling of cigar smoke and old paper. 3 officials sit behind a long table. Greene stands alone, no lawyer. Just a folder of numbers and a steady voice that doesn't shake nearly as much as his hands do. He doesn't argue politics. He doesn't talk about free speech in grand terms. He lays the doctor's logbook on the table and starts reading deaths, by name, by date, by the units they served in. Then he lays his own paper's circulation numbers beside it, and the falling case counts from the towns that read it. One official, a colonel according to later town records, goes quiet for a long moment. He'd lost a nephew at Camp Funston 3 weeks earlier. Nobody had told the family anything beyond complications. The council doesn't jail him. They don't even fine him. What they do instead is almost stranger. They quietly stop enforcing the gag order in that district. And word filters through other regional offices that prosecuting small papers over flu coverage isn't worth the headache anymore, not with public anger rising over the secrecy itself. By winter, dozens of rural papers across 3 states are running the same kind of bulletins Greene pioneered back in September. Historians later piecing together county health records find something the federal government never tracked at the time, a measurable gap in mortality between counties with early local reporting and counties without it. Nobody will ever know the exact number of lives that gap represents. Estimates from public health researchers studying this pattern decades later put it somewhere in the millions nationwide. Once you account for every town that followed the same model, Greene never called himself a hero. He kept running that little paper until 1931, printing wedding announcements and grain prices and the occasional obituary, never mentioning the hearing again in his own writing. His name barely survives in 2 surviving issues, a county archive, and a single line in his daughter's diary. Father says the truth is just news that scares people enough to listen. 100 years later, we lived through another pandemic, and the same fight played out again. Official caution against local truth, silence against the right to know what's actually happening in your own town. Walter Greene didn't have a vaccine. He didn't have a medical degree. He had a printing press, a stubborn streak, and the belief that people deserved to know what was killing them, even when the most powerful government on earth wanted them calm and quiet instead. Maybe that's the real story here. Not the virus, not the censorship, but the simple, dangerous idea that information itself can save a life. If this kind of forgotten history hits something in you, drop a comment and tell me what you'd have done in his shoes. Hit subscribe if you want more stories like this one, the ones history almost let slip through the cracks.